Dear committee members, dear audience, let me present my 6-month progress report presentation on the PhD thesis of New Frontiers in the Diagnosis and Management of Cutaneous Malignancies. I am Lili, Gulyás, a medical doctor and a PhD student at the Semmelweis University's Department of Dermatology. I am happy to share you my vision, which is improving the diagnosis and management of cutaneous malignancies. Therefore, my mission is to identify the most effective serum biomarkers and treatment options in these conditions. Here you can see my 2 ongoing projects, and let me talk about my first project, which is investigating the predictive value of different biomarkers for post-diagnostic events in cutaneous malignant melanoma. Cutaneous malignant melanoma is the 5th most common malignancy in the US, and the 5-year survival can vary between 98 to 22%, depending on the tumor stage. And we can say that every 1 out of 3 of all melanoma patients will have a disease recurrence. Unfortunately, in the clinical practice, there are no serological biomarkers are available with relevant predictive value. Of course, there are some more conventional biomarkers which is used in a clinical practice, like LDH and S100B, but they have low predictive value. And in the past few years, some promising biomarkers appeared. And therefore, our aim is to compare the predictive value of serum biomarkers in malignant melanoma to predict disease progression and patient survival. So our clinical question is, which biomarkers have the highest predictive value of patient survival in melanoma patients? So our patients are basically melanoma patients, and we'd like to compare the different serum biomarkers found in the literature in the outcome of death, disease progression, and survival. And we hypothesize that novel serum biomarkers have higher predictive value for the prediction of survival in patients with melanoma. Here you can see the final search key of my systemic search, which was conducted in 3 main databases. It contains 3 domains. The first is about the disease itself. In the second domain are the biomarkers observed, and the third domain contains the outcomes. Here you can see the flowchart of the selection. In the beginning of the process, there were more than 19,000 hits, and after the selection, there is 280 eligible full texts for the data extraction. Here you can see the ongoing and finished analyses. I finished the data extraction on the biomarkers of CRP, interleukin-6, circulating tumor cells, and vitamin D. And the survival outcome is overall survival, but there are also will be progression-free survival and other survival data, which I'm not presenting today. And the outcome parameter is hazard ratio of the survival data. And there are ongoing analyses as well on the biomarkers of LDH, S100B, circulating tumor DNA, and complete blood parameters. So it's crucial to explore biomarkers of melanoma progression to select those patients who are at high risk for adjuvant therapy and to identify those who are at risk of recurrence. And here you can see a forest plot of hazard ratios with hazard ratios of overall survival association with elevated CRP levels. And here you can, so in this analysis, there are pro and retrospective clinical studies. You can see that the heterogeneity is 98%, which is considered high, but it could be the reason. So the reason could be because the patients got different therapies, and there were different stages in different articles in melanoma patients. But despite this big heterogeneity, in the random effect model, the pooled hazard ratio is 1.8, which so hazard ratios represent the relative risk of an event. So in this case, the deaths occurring in one group compared to another. So in this scenario, the hazard ratio of 1.8 means that the patients with elevated levels of CRP have almost more than 2 times higher risk experiencing death compared to those who had low levels of CRP. And in the case of interleukin-6 levels, so this is the same as with the CRP. Interleukin-6 is a cytokine involved in immunoregulation. And here in this forest plot, you can see that the pooled hazard ratio is 3.11, which means that So this means that the patients with elevated levels of interleukin-6 has more than 3 times higher risk experiencing death compared to those with lower levels of CRP, and these results are statistically significant too. I'd like to introduce the strength of this analysis. So these blood parameters are objective measurements, and it's a very comprehensive analysis on the literature. A lot of biomarkers are observed, and it has limitations too, like the study types are different, and the cutoff values were not the same in all of the articles for the biomarker levels. And the conclusions for the clinical practice is to find the best and most cost-efficient biomarkers to help patient monitoring and to help therapeutic decisions, and the implications for research that to find which biomarkers are worth further investigation, and that unified cutoff values are needed in the articles. Here you can see the progress of my first project, and I'm currently doing the data extraction part. And let me talk about my second project, which is investigating the safety and efficacy of systemic therapies in locally advanced and metastatic basal cell carcinoma patients. Basal cell carcinoma is the most common malignancy among Caucasian population, and there are various therapeutic options to be treated to treat this disease. But in some cases, these conditions can progress to a point where the surgical procedures are no longer feasible. And in this locally advanced and metastatic basal cell carcinomas can result disfigurement and also intracranial penetration, affecting not only the physical appearance of the patients, but also their quality of life and potentially even life expectancy. And for these advanced cases, there are some new systemic therapies are available, like sonic hedgehog inhibitors and PD-1 inhibitors. And our aim is to assess the therapeutic efficacy and safety of systemic therapies in this patient population. So our clinical question is, are PD-1 inhibitors effective for patients who fail to respond to sonic hedgehog inhibitor therapy? So our patient population are locally advanced and metastatic basal cell carcinoma patients, and we'd like to compare PD-1 inhibitors to sonic hedgehog inhibitors in the field of efficacy and safety. And we hypothesize that in locally advanced and metastatic basal cell carcinoma, PD-1 inhibitors are effective and the safe therapeutic options after treatment failure to sonic hedgehog inhibitors. And the clinical implication is that to find the most effective and safe systemic therapy for these patients. Here you can see a preliminary research key, which I'm currently working on. And to summarize my project, I have two ongoing projects. The first is about the diagnostics of melanoma and serological biomarkers, and the second is about systemic therapies in locally advanced and metastatic basal cell carcinoma patients. And I'd like to thank you for your attention, and I'd like to wish you a good afternoon with a great quote from the movie of Star Wars, "Do or do not, and there is no try." And thank you for your attention.
Maybe I will ask if I can. I was a bit surprised that for CRP, which is like the most common used biomarker for various of disease, you have quite a low number of articles considering that you included 280. So what's the most common biomarker or the one that you have the highest number of studies in melanoma?
Yeah, thank you for your question. Actually, the CRP was the 4th or 5th most hits in the selection process. The most articles I have on LDH and S100B, after that circulating tumor DNA and CRP. So this is the order, but the LDH is the most.
Thank you.
Congratulations for your presentation, and I would ask regarding the first project what do you think, which biomarkers predictive value will be the best for the patient survival?
Thank you very much. Basically, it's hard to tell, but as I've read the articles and doing the data extraction, I'm thinking about the circulating tumor DNA will be one of the best, because there so the methodology is based on PCR, and they can detect these specific mutations too, and copy numbers of variation, and so the cutoff values like 1 or 2 variants, or 3 or 4, so it's very specific. So it can predict really well the patient survival.
Thank you.
So my question is, you mentioned that D vitamin impact the outcomes of these patients, and how impact the outcomes. So
thank you.
We didn't catch it from the first class.
So the vitamin D had the hazard ratio of 2.4, but I didn't show the results here because 2 articles were vitamin D, and in one article, so there were a lot of groups, but with different cutoff values of vitamin D levels. So it's not really comparable in this way. It's just it will be interesting to do this in the systemic review part, I think.
You mentioned the PD-1 specific biologist, and what about the CTLA-4? In this treatment, treatment of the disease, there are available monoclonal antibodies targeting the CTLA-4, or combined use of CTLA-4 and PD-1 specific monoclonals?
In basal cell carcinoma, I haven't really looked. So I'm not sure about this. In basal cell carcinoma, I haven't really seen it in the articles. When I did the literature review part, sorry, I don't really know the answer
So
for your question.
the PD-1.
Yeah, PD-1 inhibitors.
Actually, what is the mechanism of action of PD-1 inhibitors?
PD-1 inhibitors. There are monoclonal antibodies targeting the receptors. Oh.
And what is the function of this receptor?
So it's a immune-based function. Sorry, you got me with this question. I will look into. Sorry.
Inhibit the T cell function.
Yeah.
This is inhibition of inhibition.
Yeah. Okay.
Okay, thank you.
Thank you.